Mom and dad keep falling. What do I do?
So give yourself a break and understand that falls happen and that, it's very difficult. You can't put them in a bubble. It's very difficult to avoid all falls. Like that is just, we need to do things to prevent them, but it's difficult to avoid all of them. So don't carry around that guilt if your loved one falls, even if it's on your watch, right? It's okay.
Is the hydration is so important. A lot of seniors forgets to drink, and they meant to drink 8 glasses of water a day. And as we know, the dehydration can cause dizziness and definitely can cause falls.
Well, as far as in the house itself, you want to look at all those rugs and make sure they're tacked down. There's no tripping hazards. That the major walkways and things in the home, the hallways are cleared to prevent any fall hazards. But then you want to do things like getting regular vision and hearing checkups. You want to make sure that they are getting regular bone density scans to look for things like osteoporosis, which can increase their risk of
Often we see is that someone falls because they couldn't get to their device. It was between where I let the device go and then get into my chair, let the device go, get into my bed. And then the reverse situation is when the fall happens.
They have seen a doctor. The doctor has told them you need to either use a cane and or a wheelchair or some kind of anything that will help them keep mobile. But they need to reiterate, you have to keep that stuff with you. You have to keep your cane or whatever with you, your walker with you. You can't go anywhere without it.
Have they evaluated for durable medical equipment? Do they need a walker? Do they need a cane? Is it time for a wheelchair? Do they need a Hoyer lift? Is the family having difficulty transferring her? Is someone going to get hurt, either the client or our caregiver? So having the correct durable medical equipment in the home, having someone assist in the shower, especially hands-on assist into and out of the shower to dry off and dress for our caregiver. So having the correct durable medical equipment in the home.
And especially in the evening time where the potentiality of when they have to get up to go to the bathroom, whether it be if they're in their chair late at night and they go to bed at night, or if they're sleeping, that will then determine, okay, well, maybe we need to have them go to bed early or go to bed later. What happen is them to fall, they break something, and then their demise, I say demise in a kinder way, get accelerated because the healing process is much slower at that age. And as we age, it's much slower, and it's harder to recover. It's in psychologically, it's hard to recover because the healing process takes a lot of mental energy as well, and a determination to get well and to thrive. Whereas that point, they may just want to give up, and their rehab is very minimal at best. That's what you want to avoid. And falls can be very critical in nature.